One clinical outcome tool that we found very helpful to us is a patient-centered outcome. We asked the patient, what would you like to be able to do as a result of the therapy we do with you? Would you like to play golf? Would you like to lift your grandchild? Would you like to simply be able to walk or get in and out of bed or climb stairs more easily? We asked the patient to give us 3 or 4 of those items and then rate them where they are right now. For example, I'd like to play tennis. Right now, 0 means I can't do it at all. 10 means I can do it with no problem. So let's say I'm at a 3 out of 10. Then I go through the therapy or the treatment or the surgery or whatever. And I ask the same question again. As a result of what we did, are you able to function better? And it really doesn't matter what the patient says, what the particular idea they have is that they'd want to do better, but it's the change in their score that matters. So now we can take a whole aggregate group of patients and look at the change in their scores. They all went from 3 to 6 or from 4 to 7, the average change. If it's statistically significant and if it has clinical meaning, then that has great value to the patient and it gives us a lot of information. One of the reasons we like this better is because some of the standardized tools for clinical outcomes ask patients about things that they typically don't do. For example, a lot of people might not try to walk a mile or might not try to walk half a mile. Or a lot of patients don't have any trouble getting in and out of chairs. Or a lot of patients may not lift a 25-pound weight from the floor to their waist or lift it from their waist over their head. So because the tools are standardized, there are certain questions we have to ask in order to try to get something from it. The patient-centered outcome is a wonderful tool because it's tailored to the patient. And 2 things happen when we do that. When you do patient-centered outcomes, the patient buys in psychologically because they're saying what they want to do to get better. When that change occurs, not only have they seen the functional change, but they see that they're the ones that have done it.